Hi, my name's Jackie Wagner. I am a nursing student, and today I'm going to show you how to administer blood products via an IV. So first and foremost, I'm going to check that there's an order for the patient. So we have Betty Jones, date of birth 5/21/1952, and we do have a signed consent form for 1 unit of packed red blood cells for Betty Jones. And so we're going to verify that we have the consent form signed by Betty, and it looks like we do. We also have the doctor's signature on there for the order. After we've done that, we're going to gather our supplies. So I have some clean gloves, I have tape, alcohol prep pads, a saline flush. The saline flush is not expired and doesn't look like there's any particles floating in it. We have our sterile blood tubing or Y-port. We have a 250 milliliter bag of normal saline. Also within, it's not expired, it doesn't look like anything's floating in there. We have a stethoscope and items to take vitals before we start the transfusion and during the transfusion. We have our packed red blood cells. Doesn't look like there's any separation or clumps, but we are going to double check everything with another coworker before we transfuse. So I'm going to wash my hands. Looks like I have everything I need. So I'm going to introduce myself to the patient. So knock, knock, knock. Good morning, Miss Jones. My name's Jackie. I'm one of the nurses that's going to be helping you today. Looks like the doctor ordered some packed red blood cells to be administered today. And I know that he was in. Did he talk to you about this? And she says that he has. And I'm sure that he went over any transfusion reactions that you may have. And she said yes, he went over any transfusion reactions she might have. So first and foremost, can you tell me your name and date of birth? And so she tells me Betty Jones, date of birth 5/21/52, which matches her armband and her order. So I know I have the right patient. I'm also checking her red armband, and it looks like she has been cross-matched and typed. And we'll go over all of that with my coworker. So, do you have any allergies? And she says no, she does not. So some of the transfusion, like you may remember Dr. Packerbacker going over with you, some of the transfusion reactions that could happen with this transfusion is shortness of breath, nausea, vomiting, lower back pain, chills. So if you are starting to feel swelling or you're not feeling well, please let us know. I will be with you for the first 15 minutes of the transfusion, and we're going to be doing vitals to make sure that we catch anything beforehand. But just make sure that if you're feeling different, let us know. And she states that she understands. She seems competent and able to understand commands. First, Ms. Jones, what I'm going to do is I'm going to do a quick set of vitals on you. I want to make sure that everything's within normal limits before we get the transfusion going. And she says she understands. So first and foremost, I'm going to be taking a blood pressure. We're going to be getting an SpO2 respiratory rate, temperature. We want to make sure she doesn't have a fever to begin with. And I'm going to be listening to lung sounds. And all right, so I'm just going to have you, I'm going to go up under. I just want to make sure, I'm going to have you take some deep breaths, okay? All right. Deep breath. All right, I'm also going to check her lung sounds posteriorly, but as of right now, everything sounds clear and equal bilaterally in the front and the back. So at this time, I'm going to have my coworker come in, and she's going to verify, our blood order. Okay, her name's Christina.
Hi, Jackie.
Hi, Christina. I was wondering if you could verify the blood products.
I would love to.
All right, so we do have an order and a signed consent from Dr. Packerbacker.
Wonderful.
Showing 1 unit of packed red blood cells.
Yep, and we have a unit of packed red blood cells here.
Okay, so our patient today is Betty Jones, Date of birth 5/21/52.
Betty Jones, 5/21/52.
We have a med record of 224466.
Med record 224466.
Account number 123456.
Account number 123456.
And our patient is Betty Jones.
Betty Jones.
Red armband number 456654.
456654.
And the patient's blood type is B positive.
Blood type is B positive.
Donor number 7890.
Donor number 7890.
Volume is 250 milliliters.
250 milliliters.
And we have packed red blood cells.
Packed red blood cells.
Expiration date is 5/22/2020 at 2000 hours.
5/22/2020 at 2000 hours.
Donor blood type's O positive.
Donor blood type O positive.
And the compatibility test was completed on January 2nd, 2020.
Compatibility completed on 1/2/20.
Great, thank you so much.
You're welcome.
Christina. So once again, as we're looking through this, we want to make sure there's no clumps. We want to make sure that it's not separated. We're going to mix it to make sure that it's fully mixed. So before we start anything, I want to make sure that she has a patent saline lock. And so looking at the book, we know that normal saline is compatible with blood. And so when we have the normal saline and the saline lock, we know that there's going to be no complications to be giving blood through that. So first and foremost, I'm going to be washing my hands. I'm going to put some gloves on. And Ms. Jones, we're just going to be checking your IV line to make sure that it works. And so it looks like, right now, before I'm doing anything with it, it doesn't look like it's red, doesn't look like there's any phlebitis. It's a 20 gauge saline lock. 18 gauge or bigger is normally ideal. However, we can administer blood through a 20 gauge. That shouldn't be a problem. One of the lifespan considerations, if we were to have a younger patient, it may be a smaller gauge. So we would just have to keep an eye on our patient to make sure that the product is going in a little bit slower. So I'm going to take my alcohol swab. We're going to swab for 15 to 30 seconds. Once again, we're making sure all air is out of the saline flush and that it's not expired. Once the alcohol dries, we're going to connect it. I'm going to draw back and I do get good blood flow. And so we're going to be pushing in. Betty, if you're feeling any pain, just let me know. And she says there's no pain, doesn't look like there's any swelling. It's going very easily, which means we do have a patent line. When it's done, I'm going to clamp. And so it looks like we have a patent saline lock. So we can start getting our stuff ready. I'm going to wash my hands. I'm going to get my blood tubing out, and so this is a Y port. And so what we're going to be doing first and foremost is we're going to be flushing the saline through it first. So once again, this is not expired. It's 250 milliliters of normal saline, which is compatible with the blood product. Doesn't look like there's anything floating in there. So we're going to spike it. We want to make sure all of our roller clamps are closed. And they are. And so it doesn't matter which Y port that we put on first. We just want to make sure that there is a filter with the administration set, and there is. Okay. Opening it. We want to make sure that the we're going to be priming it. We want to make sure that our filter has saline above it because we don't want there to be any damage to these cells as they're going. So above it. So now we're going to make sure all the air is out of the line. So now I'm going to clamp this shut. I'm going to set this over here and wash my hands. Have you had any transfusions before? And she says that yes, she has. We do want to keep in mind, the more transfusions they've had, the more likelihood there could be of her having a reaction. Did you ever have a reaction with that? And she says no. So just make sure that you let us know if you're feeling anything. So we made sure that it's separated. We made sure that we made sure that it's not separated or there's any clumps. And so now that we have our line primed with normal saline, we have it clamped. I'm gonna make sure that line is also clamped. We're going to connect our blood. Like I said, we want to make sure that that's above the filter so there's no damage of the red blood cells. Alright, so once we have that connected, we are only going to be opening up the blood tubing. This one up and make sure that it is above. So I'm going to clamp that. Alright, so now that we're ready for the blood, we made sure that our normal saline is clamped. We're going to open up our blood tubing. And we want to make sure that it goes just down to the top. So we got that. Now we're going to do our other roller clamp, which is right in my hand. We want to make sure that it's not coming out. We just want to make sure that it is, and you can see that it's going through the tubing. We want to watch for when it gets down to the top because we don't want any of it to go into the garbage. And we're there. Alright, so we're going to clamp that on. We're going to be taking our alcohol swab. We're going to be connecting it to our patient, so 15 to 30 seconds. Make sure this is unclamped. We can undo this clamp. And so we are going to put our tubing in. And we're going to start it at 50 mLs. Now that it's a closed circuit, I can take my gloves off. I'm going to wash my hands. And for blood products. We're going to be starting out, now it is 250 in there, but we aren't going to put in 250, so we'll put 200 and we can check on that when it alarms. And so we're going to get that started. So you can see 50 mLs, you can see it, 50 mLs. And so we're going to undo our roller clamp. And we're going to have that transfused. Within the first 15 minutes or facility protocol, we're going to be rechecking vitals. We're going to check temperature, blood pressure, respiratory rate, lung sounds. If we have an older patient, we may have to look for fluid overload, so we're listening for crackles in the lungs, shortness of breath, and if that were the case with no other transfusion complications, they might just tell us to slow it down. As if she's tolerating it and everything looks good, we can increase it between 120 generally for a rate. And as long as she keeps tolerating it, we're gonna keep repeating vitals per facility protocol, probably every 15 minutes or so until she's done. So once she has finished her transfusion, and let's say there's no adverse reactions, if there were an adverse reaction, we would stop the transfusion immediately. We would spike a new bag of only normal saline. We'd assess our patient, contact the provider, and possibly send the blood and tubing down to the lab to check it out, and maybe give some medication for any of the symptoms that she may be having. Otherwise, if she finishes the transfusion with no adverse reactions, we're going to pause it. We're going to clamp the blood tubing. We're going to run only normal saline through for usually 30 milliliters to clear the line out. And once that tubing is completely free and clear of blood products, what we can do is we can discontinue the line. So we're going to wash our hands. How did that go, Ms. Jones? How are you feeling? And she says she feels fine. If there were another unit of blood going in, we want to make sure that it's in within 4 hours. We want to make sure that we are getting the blood in no longer than 30 minutes after it's thawed out. So we want to make sure that we're getting it in quickly. We want to make sure that it's infused within 4 hours. If it's going to be within 4 hours and they order another source of blood, we can run it through the same tubing, but as long as it's within that 4 hours. If there's more than one unit going in, they may want us to use a blood warmer. However, there were no orders for that today. It looks like there was just one. So we would be, once everything's cleared out, we would be taking the blood tubing off. We'd make sure everything's clamped and that her line is clamped. Everything's clamped. We would discontinue it. We'd take the blood and the tubing and the saline and we would dispose of it in a biohazard or per facility protocol. We're going to dispose of all of our other materials appropriately. I'm going to take my gloves off, wash my hands. We're going to document the pre-transfusion vitals, the vitals throughout it, the blood type, what type of blood, make sure that everything matched, make sure we have the consent in there. Any adverse reactions, if there were any, which there were not. Make sure that the client's bed is down, make sure they have their call light and that they're comfortable, and know that we're going to keep an eye on you, Ms. Jones, for a while to make sure there's no adverse reactions. And we're done.